This bit of video is about wrong site surgery, and it's much more common than you may think. Research by the National Patient Safety Agency reckons that it occurs at least once a day in the NHS, probably 400 times a year. And in an acute trust the size of Derby, that represents about 2 incidences every single year. And it actually involves people like us, there's no doubt about it, and it's devastating for everybody. Terrible, obviously, for the patient, but also for all of the clinicians involved. So we need to do everything we can to try and avoid it. A couple of years ago, the National Patient Safety Agency produced a document requiring us to sign several steps of the way through the patient's journey toward a procedure. So that included on the ward to say you've made a check of the notes, in theatre before the patient's anaesthetised, and then have a stop moment just before the patient has any kind of procedure. Now what we've done in Derby is we've taken that piece of paperwork and put it onto a plastic form which is attached to the patient. The idea being is it stops people cheating, and people have been known to cheat in other institutions I've been at. I've seen people sign 100 forms at a time. I've seen people take the patient's notes miles away from the patient and ask the surgeon or anaesthetist to sign, all of which really stops the important aspect, which is at the root of the problem is a failure of communication between the patient and the clinician. It's really important that every time we do one of these checks, we look at the notes and discuss with the patient what's going to happen, because mostly they're the people that know what the day ahead is. So I've got here a safety band, and I thought we'd talk through it and look at the different boxes and what they're for. These boxes are self-explanatory, but we'll just run through them. We need a date and name for the patient, so that when it's filed in the notes afterwards, it forms a document. In the procedure box, it's important to write in the procedure in full, including a side. Don't use right or left as an initial, use the full word, so right nephrectomy or whatever. It's also important to use this for all procedures, because more than half of the errors actually are the wrong operation completely rather than just the wrong side. So write the procedure in full. The time to fill it out is when you're performing the consent or confirmation of consent, when the patient's admitted to the ward. And at that point, if you're the consenting or confirming doctor, you write in here your initials where it says Dr. 1, and ask the patient to also confirm their understanding in the patient box, again just by initials. The patient will then wear the band, so you pop the band on the wrist, and the patient won't be allowed to leave the ward until that's happened. And then once they come down to the anaesthetic suite, again the patient will need to be checked, an initial made by the anaesthetist and the surgeon. The surgeon signing to say they've checked their notes and they're happy that everything's available that's necessary, and they've confirmed with the patient the procedure, and the anaesthetist is confirming to say they are going to give the appropriate anaesthetic, because there have been block errors in the past, wrong-sided blocks, etc. If you're an anaesthetist and you put your patient off to sleep without the surgeon signing, you're quite clearly assuming a greater level of responsibility to ensure the patient's going to get the correct procedure when the patient moves into theatre. These final checks are performed, as I say, before the patient is anaesthetised. Patient's then taken into the theatre itself, and then there's a final stop moment. Now what we'll do next is we'll go and see the band in action, and we'll follow a patient through their journey so that you can see exactly how it works on a day-to-day basis. Morning. Hello there. Hi, I'm Mike Henley, one of the doctors. Nice to meet you.
Hello.
Hi. Now, we're just going to go through some paperwork.
Okay.
They come for your operation, but we just go through a few formal checks before we start.
No problem.
Make sure we get everything absolutely right. Okay, so we'll start off with your notes. I wonder if I could ask you to first of all confirm your name for me.
Yeah, my name's Green Apple.
Fantastic. We know exactly what operation you're having, but I wonder if you could confirm that for me as well.
Yeah, I'm expecting a circumcision.
Okay, lovely. Well, I'll just flick through and make sure that all the details are correct in here.
Okay.
Yeah, it's definitely the right name there. And we'll just look at your clinic letter. That's smashing. So your clinic details all say exactly the same thing. What we'll do is we'll fill out one of these little bands, and then I'll get you to sign it, and I'll pop it on your wrist to say we've done the relevant checks. So the first thing I fill in is the patient's name, so it's Mr. Green Apple, and I do that along with checking the notes to make sure that the notes and the consent form all tally together. We'll put today's date in, and the procedure as confirmed by the patient. And then there are 4 boxes for initials. I'm the consenting doctor, so I'm going to put my initials in, Dr. 1. There's a slot here for the patient to put his initials, which we'll get him to do in a second. And then the surgeon for around in the anaesthetic room, and then the anaesthetist. So I wonder, Mr. Apple, if I could ask you to sign this for me.
Yep, no problem.
There we go. Any more questions there, Mr. Apple, about any of it?
No, everything's fine, thank you.
All right, well, I'll be back to you later.
Thanks very much.
See you in a
Cheers.
bit.
Thank
Cheerio.
you. Bye-bye.
Hello then.
Hello.
Hello, Mr. Apple. This is Mr. Green Apple. This is Mr. Thomas.
Hello, sir.
Mr.
Hello.
Green Apple has come today for a circumcision. Hospital number 555513. Date of birth the 2nd of the 8th, 65. Today's date. Mr. Green Apple, circumcision, signed by the patient, by the doctor, to be signed by Mr. Thomas, signed here. Circumcision, no knowledges.
Right, thank you very much. Can I just have a little look at the notes?
Thank you.
Mr. Greenapple, nice to see you.
Hello.
You understand what you've come in for?
I do indeed, yes, the circumcision.
That's wonderful, yes, it's all written here. And we've been through the nature of the surgery, so I'm very happy that everything's documented.
Yeah,
That's great, so we'll have you sorted out and
Thank you
very
much.
shortly.
Thank you.
Thank you very much. And what I now need to do is just to confirm with you that the wristband says circumcision here,
Yes.
and you've signed, and I'm just going to sign so that we take you into the theatre and everybody knows what you're having done.
Okay, that's fine.
Okay.
Thank you.
Very good.
Lovely, thank you.
Thank you.
Hello, Mr. Greenapple. I'm Dr. Gabriel. I'm the anaesthetist. We met earlier in the ward. So now I'm just confirming that you know what you're having done, right?
Yeah.
You're having a circumcision.
I am indeed, yes.
And I'm just signing to make sure your consent and your band are the same thing, okay? And your date and signed, and I'm signing here as well. Okay?
Thank you very much.
Thank you. So we're ready to send you off to sleep now.
Okay.
Stop everybody. Just want to do a stop moment. This is Mr. Greenapple, Eileen. He's for a circumcision. His date of birth is the 2nd of the 8th, 65. Yep. Hospital number 555513. Yep. And his green armband says circumcision, today's date, the 25th of July 08. Mr. Greenapple, signed by the patient, the doctor, the surgeon, and the anaesthetist. No knowledges. Thank you. I wasn't anonymous.